Dr. Prasanna Venkatesh Ramesh. He is a glaucoma and medical research officer at Mahatma Eye Hospital, Trichy. He has published 67 articles in peer-reviewed and PubMed index journals, including 36 in our very own Indian Journal of Ophthalmology. He is also the glaucoma section editor of the TNOA Journal of Ophthalmic Sciences and Research. He is the chief instructor at various conferences, including the ASCRS 2022, GSI 2021, AOS 2021, AOS 2020, and TNOA 2019. And he is a recipient of various awards in World Glaucoma Congress, IIRSI, AIOS, GSI, TNOA, and DOS. Over to you, Dr. Prasanna. He is another serial innovator.
I call him the new sensation, Prasanna. Really fantastic.
So thank you, Mohan Rajan sir and team TNOA for giving me this opportunity. Am I audible, sir?
Yes, sir.
Yes. So the augmented and extended reality 3D ophthalmic metaverse is what I'm going to be talking about for the next few minutes. So welcome to the world of 3D ophthalmic metaverse. So initially during the starting days, it was all about filmmaking and animation for me, the innovation one. Being a glaucoma person, I used to make some animations on common encountered practical difficulties like the iris process and peripheral anterior synechiae, and then match these animations in real-time clinical scenarios during my fellowship days. As you can see, the iris processes and the peripheral anterior synechiae. This is how I developed my metaphorical concept learning. The more I went into animations, the more I realized the creation of unanimated models, because we want to have a real model as much as possible so that we can teach well and we can also have a good patient counseling system also established better. So we started using real wide field 110-degree true color confocal fundus images of the own patients themselves, of their color, autofluorescence, and infrared to make the posterior segment models. And we used real-time slit lamp and gonioscopic images to make the anterior segment models. By doing this, we developed our first own app, IMG3D, which is a three-dimensional app, and we give the choice to the user. We place 12 cameras inside this app, and you can click the button. If you click the anatomy button, it goes into the 3D model. You can choose your anterior segment, and then you can click the angle or the ciliary body. If you click the angle, you get the gonioscopic view as and when that is seen by a gonioscopy when you perform. And then we also added the trabecular meshwork. These are all the add-on buttons for electron microscopic view. So these are all the 3D models that we created with inspiration from our real-time patients' data. And the posterior segment, you can see the real true color confocal unanimated images. And we gave the choice to the user to remove the vitreous on, off, or the silicone on, off, and the fovea, which can also be visualized. And by giving the buttons, the user can actually be, it's very user-friendly. A 3D interface is what was actually established. So this was the second innovation that we did. And we didn't stop only with that. We also added the autofluorescence and the infrared and various other models, flecked retina. All these are our own patients' data, which are now unanimated into the app. Neovascularization elsewhere with fibrovascular band, retinitis pigmentosa, all that is in multimodal. Retinal nerve fiber layer defect, as you can see here, and myelinated nerve fibers, splinter hemorrhages. So all these models are provided in this app, and this is free of cost, and it is being provided for Android users. That led us to the third innovation. Why not we go into the creation of augmented reality 3D models, which is one field that was not really explored for anatomical creations. So we went ahead and we incorporated our 3D models into a simple smartphone, and we also gave this app free of cost for the love for teaching. So you can see on the left-hand side video, the pedagogue is demonstrating the augmented reality with this phone. And the right-hand side part of the video is the display that you will actually see in your smartphone. So you can rotate your phone accordingly to access different views of the 3D model. You just need to go back, and then you can come down and see the angles. You can see the anterior segment, and now you can see the pedagogue here diving into the video, and then you'll see the and this is again another view of the phone or the camera where we have just recorded it. So the cavernous sinus models, and even as I was talking about the angles, here you can see that going in and visualizing the angle as real time as how it looks. For example, for a surgical angle surgery. So all those models are being done with real-time tissues or mimicking them. So, and also with that, we also added the multiple filters that we are talking, the red-free filter, along with the color fundus, the splinter hemorrhage that is seen here. You can see that you can choose the button and have your color-free, red-free filter. as also additives. So different pathologies atlases were created in the app, the third innovation, IMG AR. It is also available free of cost in the Google platform. That led us to, why not we go into reality? Okay, reality is reality, right? So that was the fourth innovation about the 3D anatomical puzzles. So we thought kindling the kid inside us will actually help us in working better. And in my hand, you can see the 3D model that we actually printed. This is a 3D circle of Willis that it is recently done by us. It's more like assembling and disassembling the parts of a bike, like an automobile engineer. This is a cavernous sinus that is being shown in my hand here. So it gives you the cognitive learning to understand and evolve the concepts better. This will work much better for undergraduates or for residents is what I would feel. And we have also printed the 3D eyeball models with real-time confocal fundus images. And also the trabecular meshwork. So initially in the starting phases, these are some models which will help the neophytes to really get a grasp of the basic sciences. And finally comes one of the recent innovations done last week, the creation of the 3D holograms. So we talked about augmented reality and reality, animations, unanimations. Why not we have an holograms that we see in the movies, especially the Marvel movies? That's where I got the word the metaverse. So this is the augmented reality 3D model museum that we have recently created with all our 3D models with the Microsoft HoloLens 2. You can see on the right-hand side of the video, the user is walking through as if the room is empty, but actually the room is filled up with all our eye models and the neuroanatomy models. Even the neuroanatomy models, so you can see him moving around and he's visualizing all the models in his HoloLens. The cranial nerve anatomy, the optic radiation, the nucleus and the extraocular muscles, all these are being provided in fine detail. So as he goes through, he can see the fundus images, the autofluorescence mode, the infrared mode, you name it. The future we can even develop a 3D case sheet for the patient. And this is another video where we match reality with extended reality. So here you can see that the 3D printed model of the cavernous sinus or the circle of Willis, which we did, we also put it into the holograms. And now demonstrating wise, you have the hand tracking system where the user can use it, he can turn it, he can touch it. Maybe he'll not be able to feel it, but he can rotate it and he can magnify it. And all those things that is not possible in 2D textbook reading can actually be done with this holograms, which is a visual aura as well as a hand touch tracking system is also there. I'm just fast forwarding the video for want of time. And you can see the circle of Willis here. He's taking the circle of Willis hologram and he can side by side take the 3D printed circle of Willis model that is done. And in this video, you can see he's comparing, the user can compare the 3D model in reality mode as well as in the virtual extended reality mode. And the match can be done. And the learning can actually be playful, gamification, especially the 3D models that we are facing, be it the trabecular meshwork, circle of Willis, the cavernous sinuses, and being a 3D structures, and he's matching the extended reality model and the holograms together. So 3D learning can be fun, and not only it is only for learning, these also can be used for counseling, and the patients can also be given a 3D case sheets in the future. Maybe we may not be far from that where you can see the images that we have used are all real-time, true color, high resolution confocal images. These are not animations, these are real-time images. That's how the particle works. We felt confocal images will be the way forward, and incorporating them in every possible modality, being in augmented reality or extended reality, or even for 3D printing as such. So this is again one of the same models where we are just demonstrating the angles. So the gamification or the cognitive learning can all be enhanced by this, and not only with anatomy, we are now slowly moving towards simple procedures like removing a foreign body from the cornea, how we can train them in extended reality so that they'll have a simulation so that when they go to the patient, they'll be prepared. And then from there onwards, we can go into complex surgeries and so on. Even for the gonioscopic structures are also being provided as holograms so that even gonioscopic assisted angle surgeries can also be done. So this is what we have innovated. The models that we have created, we have put it into the holograms, the HoloLens 2, which is provided by Microsoft. And all the models is what we have created and we have put into the holograms for a cognitive gameful learning. And last but not least, even for iPhone users, the ITOUCH is one of the recent innovations which is in the pipeline, which is not yet launched yet, with just fingers. So what about, we just wanted to cover as much audiences as possible so that it will be, some people may feel 3D printing is good for them. Some will feel extended reality is good or augmented reality is good. Some will tell me, I just want to lie down on my bed. I'll have my phone just with the 2 fingers. I would want to open the eyeball model, rotate it. For them, just with 2 fingers, you can access different views. So you can remove the skin, then you will have the skull. Then you can choose the brain transparency. You can reduce it. You can turn it. Then if you want to remove the cerebrum, you can do it. Cerebellum, all have been done by means of buttons below. So we are giving the user-friendly interfaces and they can do the learning according to their wish. So these are the 6 innovations that have come under the Department Mahatma Center of Moving Images. We have tried to provide as much as possible. Everything is free of cost. The animations are on YouTube's. The unanimations, this is the QR code, and the augmented reality, this is the app, this is the QR code for it. But these 2 works only on Android. That's why we developed the IMG Max, which is for the iPhone users. And we have the tactile 3D puzzle assembly, which is a 3D printed one. And then the IMG Holo, which is available for as a real-time holograms to cherish it. So we have also published our work in the IJO videos, inaugural video, the animations that we done for the gonioscopy, and also the augmented reality in the January issue this year. And the others are also getting ready for more publications. So the Center of Images, we just wanted to give all the possibilities to the user in a cost-effective manner so that learning can be made easy. And as this is my acknowledgements, and as Venkatesh was telling, I was just reminding of this slide. This is my daughter. She's also using the holograms for the Barbie and all her particular things. And that's how things are going forward is what I really think. And this is my team. We have an innovation only team at Mahatma. So these are my team. I would like to acknowledge my team for the team effort. Thank you.
Wonderful. Prasanna.
Thank you, sir.
Because I have seen it firsthand, I know exactly what type of work, and now I have seen Prasanna right from the undergraduate days. And in fact, I can take the credit for counseling Prasanna into ophthalmology. Yeah.
So the holograms I have still not shown you, sir. The real holograms are the hand tracker and the tracking with your eyes that was launched last week, sir. But maybe sometime to all the elite panelists, I'll get an opportunity to show the.
Will this in the future have some clinical relevance, Prasanna?
Yes, sir. So now we have started moving towards, as I told, removing a foreign body or even any OPD procedures, gonioscopic, even inserting it and removing it. Sometimes neophytes may really find it difficult where there may be the cognitive memories, sir. Basically, the hand-eye coordination. For all those simulations is where we are now in, sir. Maybe the surgery is a long way to go, but I think hopefully we'll be able to get there in a cost-effective manner.
Beautiful.
Prasanna, I'll strongly recommend you to visit Savita Dental College. Whenever you go down to Chennai,
Yes.
Sure, John can also arrange a trip. I can ask somebody to show you around. You can see terrific simulation happening. I've never seen in my life. I've never seen even in US or in Europe like that.
Yes, sir.
One of the best simulations, where people can really feel like whatever you're talking, they're already practicing it on a daily basis for both treatment and also for training. Yes. I mean, you can't see a practice like that where they take real teaching into day-to-day practice. And I'm sure if you go there and see, you'll get an idea of how you can take this to the next level.
Yes.
Because I'm sure all these are for the next generation. Like we talk about the children now are internet children who are born during the internet period, right? So they browse everything. But still technologically, they seem to be so uncomfortable. They think they are in the Google world. But when I ask something about technology, many of them are really, they don't even know how to put a good PowerPoint slide or make a 2D animation or make a small movie. But somewhere that is also lacking in part of it. So somewhere if you want to take this around and see how it really applies for teaching, that's a great place to see, which is within our state.
Definitely.
Yeah, Suvan Kumar.
Science. We are getting transported to science fiction now, I think, slowly. Great work, Prasanna. Really appreciate. And the fact that you're making it available for teaching right now is fantastic. I think learning is getting easier for the kids now. Thank you for that. And you're gonna do a lot of good work for us.
Thank you.
Yeah. Wonderful, Prasanna. And Shall we go on to the next speaker? The other panelists don't have any words? Anything to say? John.
So the metaverse is already here. So Mark Zuckerberg realized that, and he changed his company name to Meta, and he has collected all his other companies as parts of the metaverse. Prasanna is also doing that. He is creating a metaverse of all his innovations, and in fact, because of all this, virtual reality and augmented reality are going to be very affordable. In fact, Geo glasses are there. Facebook is trying to get affordable augmented reality. Apple is trying to get augmented reality coming on, which will not be affordable, but that will make everybody accept augmented reality. So very soon, all this is going to be very easily accessible to everybody. So it is not something which is in the distant future, it is already here.
So an idea of bringing different innovations was to reach as many people as possible. As some people may be comfortable with the models in reality, some people will be comfortable with extended reality. And the cost factor also, as much as possible, we have provided the AR app free of cost. And but for the HoloLens per se, at least they need to have an HoloLens, which is around $2,500 US. So, but again,
it will come down. It will come down drastically soon.
Very nice, Prasanna.